Okay? And so when you've done, so this is the place on fluoro. You say, okay, this is where the proximal end of the stent should be. And then what I do is under fluoro I pull this back, and when the tip comes into the cannula, or you can see it coming out the scope, that's when you stop. But you have to remember it's one movement. And then we stop here. And then we have a scale. We can exactly measure what you need, and you can put that side step. Okay? Now that's one way of doing it. It's cumbersome. I don't normally do it. Okay? With our experience, I can tell you this is this is the stent. So I'll be 1 centimeter, 2 centimeter here or there, which doesn't make any difference. General rule: if you have an ampullary lesion, 5 centimeter stent is fine. If you want to go cover the distal CBD, so you have a pancreatic cancer involving the distal CBD, a 7 centimeter stent generally would be sufficient. It will take you almost to cystic duct or above. Anything up to the porta, 9 centimeter is fine. Okay. Anything involving the porta or going above, you need to really go in 10, 12, 15, depending on what. Depending on. Now 15 I only use for post-transplant patients. Living donor liver transplant. I use 15 there sometimes, not always. If there is a lot of, now this is again with experience, sometimes the duct is very flexible after the surgery, and when you're trying to insert the stent, a lot of stent goes in this curve. So although you don't need that long a stent, but if you don't have long enough stent, you don't go in. Once you're in, it actually goes in further than you want, but if you don't have long length enough. So basically 10-15 is really for living donor liver transplant as far as I'm concerned. Hardly ever have I seen a stricture that's, oh no, I wouldn't, maybe, I put 3-4 stents in a year. There are maybe 2-3 stents in 10-15. Most stents that I place are either 10-10, 10-12, or 10-9. Or 10-10, 10-9 is the same. 10-7 I would only put in distal CBD involved.
Sir, in the living donor the transplant, where is the anastomosis? Common hepatic ducts?
No, living donor transplant में उसने पूरा liver निकाल दिया.
Yes.
उसकी जो duct है, यानी now recipient duct is joined with the two systems, anterior and posterior branches of the donor liver. Okay, so you see it like this. Okay. Now, bile duct is also like my arm a little bit.
Yeah.
It's curved like this because of surgery over there. So if you have it like this, you can imagine you're going like this, and as your cannula turns, now you lose this because this is actually pushing away. So you're losing the thrust going up, and that's what makes it difficult, even when you're placing a stent or whatever you do. In my experience, living donor liver transplant ERCPs are probably one of the most difficult ERCPs I do.
And usually the stricture is at the site of
रेफरेंस
anastomosis.
ये से इट्स वेरी डिफिकल्ट टू गेट सिटी से आते हैं आउटसाइड सिटी से रेफरेंस जो है हमारे ट्रांसप्लांट तो उसके गांव
पाकिस्तान से आए हैं।
गाँव में कहाँ ट्रांसप्लांट शुरू हुआ? 3 ट्रांसप्लांट।
हां 3 अभी बस एक्सपेरिमेंटल बेसिस पे
Most patients I do are from India, but I've done a few from Shifa as well.
Sir, SIUT.
SIUT doesn't.
एक हुआ था कि वो फेल हो गया
SIUT I don't know कितने होते हैं, लेकिन ये बहरहाल regular transplant
What
कहीं पे नहीं
happens in
होता.
the Gumbard, the both patient dies.
Gumbert का problem ये है कि I mean only yesterday I did a patient who was operated in India, went to Gumbert for ERCP. ERCP was attempted. I don't know what was done. Again ERCP somewhere else was attempted. They couldn't do it, so then they put a PTBD, and the patient was in a bad shape. And then the patient was referred to me, and we put both anterior and posterior stents yesterday and took the PTBD was only in the anterior system. So it was draining the anterior, not the posterior. So I went in, I put stent both system, took the PTBD out.
Two stents.
Yeah, you have to stent both systems. Initially, when you're doing initial first case, sometimes I just put a 7 French 2 stents.
Because you have to put two stents.
No,
Even
because
so-
initially you don't want to stretch it too much. So I put a 7 French in both systems, leave it, bring them back in 3 months if they're stable, and take those 2 out, put 10 French in both systems. Leave the 10 French for 3 to 6 months and then take both of them out, have a look, fine, just leave it.
Even at a time, it's very difficult to get into final resting transplant patients, right?
Exactly, and the way to do that is that's the only time where left lateral position helps.
Pressure abdomen.
Pressure abdomen also helps, but more importantly left lateral. So you put the patient left lateral, you can use pressure if you want to, and left lateral works for me most of the time. Never had a problem. Thank you, sir.
Thank you.
I'm sorry to have put you
नहीं
2 years behind, but
that's okay.
we live in Pakistan.
नहीं है कुछ जाना पहचाना सा लग रहा था.
लग रहा था. Sajda, are we done?
Can we go, sir?
Yeah. Well, that's, yeah, we're done. We don't have to, they don't have to wait. That's out of course. Okay, we have a faculty post, course dinner, which will be tomorrow at Kulachi and Ocean Mall. Now Kulachi यहाँ पे 2 हैं. एक 2 दरिया पे है, which is समंदर के साथ. ठीक है, for those who come from outside Karachi. We are not going there. We are going to दो तलवार Clifton.
डॉक्टर प्लाजा के साथ
जो डॉक्टर या जो उसके साथ वहाँ पे एक ओशन मॉल है, बड़ी सी बिल्डिंग है, 30 odd stories. उसके अंदर जो है ना, there is 5th और 6th floor पे है कुलाची. No, not roof. It's 5th or 6th floor. Food court के ऊपर. Food court is separate. This is separate. This is I think 1 floor above or 2 floors above. वहाँ पूछ लेंगे आप किसी से भी ओशन मॉल में, तो वो कुलाची आपको बता. So tomorrow what time, Sajid? If there is anybody who has problems reaching there or who's come from outside Karachi, contact somebody tomorrow. Maybe Dr. Sajda से contact करने, so hopefully we can arrange for someone to actually liaise with you. Okay. So that was it today. We have some course material for you in that USB. You can have a read through. If you go and look at some of the videos available, Dave Project would have some videos for you. If you want to go to Dave Project, that's free. YouTube पे वैसे भी सारी चीजें आ जाती हैं. If you have Peter Cotton, you can actually read through it. You can read cannulation. You can reinforce what we have said today. Come back fresh tomorrow, and we'll have exciting 3 days, inshallah.
tomorrow at 9.
Tomorrow we start what time, madam? 8:30. If the hands-on guys are late.
It's written said 9 o'clock, and that's why I say.
9 o'clock लिखा है. आपके letter
No,
क्या है?
8:30.
No,
8:30. Tomorrow, so day
We're
2.
starting 8:30 tomorrow because 3 candidates are left from today who want to.
So हमें जल्दी करना पड़ेगा, और आज हमारा थोड़ा सा लेट हुआ है, तो we need to cover that up. So, but लेट करने में hands-on वाला का मसला ये है कि if you come late, you miss out on one case. So we decided last time that that's how we penalize. So hands-on late means one case gone, so the other case will go to someone else. Okay?
Thank you, everybody. Thank you, sir. Thank you.